Morning.
Good morning, sir.
Good morning, class. Today, Anna, we will dwell into a very critical condition related to our nervous system. We will talk about hydrocephalus. Sino may idea about this topic?
Sir,
Okay, Yana.
Central nervous system isa, di ba? Based sa name, hydro means water, dayon cephalus means head. So bali may water sa head.
Correct, Yana. Excellent. But technically, it's not ordinary water. It is an abnormal buildup of cerebrospinal fluid or CSF inside the ventricles of the brain.
Sir, anong common causes yan naman nga build up ang fluid daw?
Good question, Yul. It can be congenital, meaning subong pa lang pagkabata, o can acquired later in life due to tumors, meningitis, or traumatic brain injuries. Structural blockages prevent the fluid from draining properly.
sir, makita ginadayan sa physical appearance ng tao?
Sa mga babies, yes, kay naga-enlarge ila ulo structures since soft pa ila nga cranial sutures. Pero sa adults, ang structures are already fused, so iba ang symptoms. High intracranial pressure causes severe headaches, vomiting, blurring of vision, and even cognitive changes. Class, remember this topic because we will have a major quiz next meeting. Okay, class, let's start the topic. Hydrocephalus, it is the abnormal collection of cerebrospinal fluid within the brain, indicating hydrocephalus and non-communicating hydrocephalus.
Thank you, sir.
Kawit dahil din ka makadto.
Live ta?
Kay live ta? Tata. Mizan, ano yung magatunan man?
Rodahan na toy. Nga po mo lang sa pwede to no.
Tuon tayo.
Sige. Oo naman oh. Nabudlay ang mamagina sa discussion ni Sir Zach.
Yan, gid ko to bala kagina sa radana, wala gid ko may naintindihan.
Gani, budlay gid man, pero wait, ma-search da na sa YouTube or sa Google basi may mga documentaries bala upon mga patient stories para mas maintindihan naton. Oh look, Ario Luis Vargas, a hydrocephalus patient who had a successful surgery of brain shunt to remove excess CSF tanawon tani.
It is actually an abnormal buildup of cerebrospinal fluid inside the brain's ventricles, not ordinary water. Normally, CSF cushions the brain and clears waste. But if a blockage occurs or absorption fails, the fluid accumulates, causing the ventricles to widen and exert dangerous pressure on brain tissue.
In infants whose skulls aren't fused, it causes a rapidly growing head size and lethargy. In adults, the rigid skull prevents expansion, leading to rapid pressure buildup, severe headaches, and vision issues. We also see normal pressure hydrocephalus in older adults, which mimics dementia or Parkinson's through a classic triad: walking difficulties, urinary urgency, and cognitive decline.
The traditional method is shunt system, a surgically implanted tube that channels excess fluid to the abdomen to be reabsorbed. Alternatively, we can perform an ETV. We use a tiny camera to create a small bypass hole on the brain's ventricles, letting fluid flow around the blockage without needing a permanent implant.
Recovery requires a multidisciplinary approach. Relieving physical pressure is just the first step. Physical therapy and cognitive rehabilitation are essential for patients to fully regain mobility and function.
While the clinical mechanics are vital, nothing highlights the impact of early diagnosis and modern neurological intervention quite like a personal journey. To bring this home, we want to share the story of our patient, Luis Vargas.
When Mr. Luis Vargas came to us, we immediately ordered a brain CT scan to correlate his clinical symptoms. Look at this radiographic image.
Yes, Dr. Heidi. Normally, ang ventricles natin slit-like lang o kung gamay. Pero diri sa CT scan ni Luis, it shows significant ventricular megaly. Grabe ang pagka-enlarge sa lateral and third ventricles. This confirms the diagnosis of obstructive hydrocephalus. The fluid pressure is pushing against his cerebral cortex, which explain his severe headaches and loss of motor balance.
Exactly, and radiographic imaging like CT scan and MRI are crucial here. Hindi lang ini para sa diagnosis. It helps us map out the exact location for surgical intervention.
As a radiologic technologist, we ensure that the high-resolution images are precisely acquired para sa surgical planning. Subong, the patient is being prepared for an urgent neurosurgical procedure, the insertion of a ventriculoperitoneal shunt.
The VP shunt is a plastic tube that will drain the excess cerebrospinal fluid from his brain ventricles down to his peritoneal cavity, where his body can safely reabsorb it. This will immediately relieve the intracranial pressure.
I'm Luis Vargas. Before my diagnosis, I was trapped in a living nightmare. Every morning started with a blinding, severe headache. I thought it was just stress from school and work, but then the vomiting started, my vision blurred, and I completely lost my balance. When my memories started flickering, I was terrified. I felt like I was losing myself. That is when Dr. Lyle and Dr. Heidi stepped in. They discovered that it was hydrocephalus and explained that I needed a ventricular shunt. Going into surgery was challenging, but their reassurance gave me strength. During the operation, Dr. Lyle skillfully implanted the shunt system to divert the fluid building up inside of my brain. The procedure went beautifully and was a total success. Waking up post surgery, the relief was almost instant. The intense pressure in my head was gone. I'm still recovering and working to get my full strength back, but I have my life, my balance, and my mind back. I want to say a massive, heartfelt thank you to Dr. Lyle and Dr. Heidi. You didn't just perform a successful surgery, but you saved me.
Grabe, gali no. So, ang patient, amo na gali nasalbar sa kabuhi ni Luis Vargas. Ano sa CT scan, nakita gid ang delikado ang pressure sa iya utok. Hydrocephalus is a very fascinating and beautiful topic. No? Doon na ganahan mo mong tuon ba?
Gani no, at least prepared na ko para sa quiz boss.
Pero kabalo ka, do ka familiar bala sa ngalan nga Luis Vargas, kag may kalokalike sa.
Ganin. Pero ba si ano lang niya, common name lang niya, or common face. No?
Basi. Sige na, let's review no para perfect boss.
Ganin.
Uy, ready na ka mo? Grabe, magpa-quiz si Sir Zach. Structural pathways, sige ang AI pa-quiz.
Ang kulbaan ko pero nakatuon kumayo kag nagtanaw kami case study kagapon.
Good morning. Amo ning room ni Mr. Zach. Ari na di siya.
Good morning, sir. Do, ay pa man sa sir.
Di pwede lang ko di kasulod.
Sige, sir. Slow lang na, sir.
Sige, thank you.
Ready na ka mo? Grabe, magpa-quiz si Sir Zach.
Good morning, class. Sorry I'm late.
Good morning, sir. May gola, tayo sa mo, sir.
Sir, are you Mr. Zach Luis Vargas?
Luis Vargas? Si Sir Zack? Kagang patient sa video? Siya to gali? Tanawon ko, be?